Yes, there is. When you do athletic activities, you are basically training your heart. So if your heart is trained, it learns to beat slower than usual. And the goal of that is to build up enough reserve so that when you need that faster heart rate for performance, it will be there. Remember, the heart muscle is like your regular muscle that you can see, like in your arms, in your legs. If you train your arms a lot, if you lift a lot of weights, you're gonna see your muscle get thicker, get bigger muscles. Same thing happens inside your heart. If you exercise a lot, you are using the heart muscle a lot, then with time, your heart muscle is gonna grow. It's gonna get thicker and more bulky inside. It depends on what caused your heart to enlarge. Typically, physiological enlargement, if it's from physical exercise, typically they don't carry necessarily an increased risk of cardiac arrest. But if it's from a congenital condition, for example, certain types of cardiomyopathy, then it may increase your risk of cardiac arrest and in certain cases even sudden death. For most athletes, it's a physiologic finding that the heart muscle is going to get thicker and even bigger than the average person. But if there's any family history of unexplained passing out or unexplained sudden death, or there is unknown genetic conditions such as hypertrophic cardiomyopathy, or if the athletes have spells of passing out, unexplained fainting, and those are the times that they need to be carefully evaluated. I think it's possible. There are some data to suggest that endurance training or distance running, marathon training, for example, in those patients, there may be an increased risk of atrial fibrillation. Certain supplements, especially supplements who have stimulants in it, for example, supplements that contain alcohol, or caffeine, or soda fat, those are all considered stimulants, and they have the potential to trigger arrhythmias, and atrial fibrillation is one of them. To learn more, please click on one of the links on the screen or the description below.